Thank you very much, Dr. Winarick, for joining us and speaking with us today. Can you tell us a little bit about yourself and how you got to work so closely with those struggling with personality disorders?
Sure. Thanks for having me. Well, aside from growing up in a family of psychologists, which, was its own exposure, so to speak, but more seriously, when I got to graduate school, I got matched with a mentor whose specialist was personality disorders, specifically dependent personality disorders. So there was just a lot of discussion in the lab about the dynamics of uh, people with different personality profiles and how they behave in different situations. And I just thought that was really interesting. And more broadly, I just think personality or personality disorders is sort of, it refers to like sort of, your emotional functioning, your uh, self-regulation abilities, your interpersonal functioning, and it's sort of the broadest and most holistic way of thinking about people, in a way that I think makes sense. So just sort of the personality disorder or personality approach always appealed to me. And then I had various clinical training experiences that brought me into closer contact with, severe personality pathology. Um, I did an externship at Bronx Children's Psychiatric Center um, with severely emotionally disturbed kids, which, you don't really call that a personality disorder, but um, later in life that can sort of develop into that. It's severe psychopathology. And I did an externship in a psychiatric emergency room where, again, you see people presenting with personality disorders sometimes, um, especially borderline personality disorder. And I just got to know about the sort of treatments available for personality disorders by virtue of training in these sort of hospital settings where a lot of these patients come. Uh, and that led to sort of my the training experience that had the greatest exposure to people with personality disorders, and that was at this adult inpatient unit at Cornell Westchester, um, which sort of specialized not explicitly in personality disorders, but a lot of the patients there have them. And it's my belief that sort of personality pathology underlies really mental health in general. So um, it's just always been an interest of mine, and it became the focus of my dissertation, which was on schizoid personality disorder. And just intellectually, clinically, and personally, I can relate to a lot of the experiences, and I think a lot of people can relate to personality disorder. If you were to take a sort of like, if anyone were to take a screening measure of personality disorders, they would definitely score, positive on a lot more disorders than they might think. The average person is like 4 or 5, I think.
Oh,
So
wow, really
yeah,
funny.
but that doesn't
You
mean you have
mentioned,
a diagnosis, just that you have traits.
yeah, of course, I'm sure it's a spectrum. You mentioned schizoid personality disorder. Can you tell us a bit more what that is, about your experience treating schizoid personality disorder?
Yeah, sure. So it's a diagnosis in the DSM that there's some controversy about its definition specifically, but the gist of it is that it refers to a pattern of behavior characterized by social isolation and social withdrawal, and detachment from the social world. So, sort of like the hermit, loner type of person, or people who prefer solitary activities. And uh, I'm, there's some disagreement about whether the DSM captures, the true content definition of schizoid personality disorder. But I mean, I think the basic gist of it, sort of my understanding, is that people, um, don't get that much pleasure from social relationships, so they avoid them. But they're also, prone to getting intensely overwhelmed by emotional experience and, fear relationships in a way. They fear this kind of intimacy of being overwhelmed by somebody else and not having your own space and time. And I think there's a more primitive fear of sort of just like a loss of self identity if you're going to be close with someone. Um, so that's the main dynamic. I think a lot of scientists have schizoid tendencies. A lot of people in academia do. The stereotypical job for someone with schizoid personality or just schizoid personality disorder would be like a librarian. Um, and the people with that disorder don't usually come to treatment because they don't really, uh, want to get into talking about their emotional life because they find it sort of so threatening in some ways that they cut off from it. Um, and this doesn't apply to everyone who wants to, who may meet the profile for schizoid personality, but just generally. Um, and just through sort of my academic expertise on the topic, I think my practice grew in terms of attracting people with this personality pattern. And so I wouldn't say that I treat a lot like everyone. It's not like everyone in my practice has diagnosis of schizoid personality disorder. But I definitely am sought out for that sometimes. And it's not, the schizoid dynamics are not totally exclusive to schizoid PD. They're also involved in avoidant personality disorder, in social anxiety, in depression. And, I think it's an important and overlooked kind of process in general in clinical psychology.
And how can you help clients who've been diagnosed with schizoid personality disorder or another personality disorder for that matter?
Yeah, I mean, through psychotherapy and sometimes a combination of therapy and medication. Um, people generally come to therapy because they're having problems, either with their work or in relationships, and it's usually a pattern of problems. And so I think, therapy is really geared toward people with personality problems and personality disorders. So how the question is, how would I help them? Like what techniques? I mean, try to help them become aware of what maybe dysfunctional patterns that have been repeating in their life that they engage in, and the roots of those in terms of their history, to help them understand, why they do what they do, and to help them, learn more effective ways, or try out new effective ways. Basically, I'm trying to help them. I mean, this is for personality disorders in general. It's just sort of help people get better at self-regulation and, interpersonal relationships becoming healthier. And that involves different things depending on the person and whatever their specific issues are. But those are the general areas.
Right. Yeah, I'm sure it's very individual also for the
Yeah.
client.
Um, with schizoid personality disorder specifically, I think, I wouldn't, really push someone to go out into this to be social and extroverted or something. I would take the approach of like encouraging them to, enjoy solitary activities more. But to, slowly, maybe talk about their feelings about what it means to have a close relationship and to facilitate the expression of, emotion would be a goal too.
It's really interesting. What advice can you give to clients who are currently feeling hopeless or lost due to a troubling diagnosis?
Main advice I would give is that there's definitely hope for whatever it is that you're struggling with, psychologically. Like the world of psychology and psychiatry really does offer a lot of solutions and ways to get better if you're suffering with mood problems, relationship problems, work problems, explosive anger, addiction. The whole range of psychopathology is treatable. Um, if you're diagnosed with something uh, that has, really a lot of implications for psychiatric medication, I think that's different than being diagnosed with other things. So I guess what I mean is, if you have got a diagnosis of bipolar disorder, for example, and you're feeling hopeless, that's one that's worth getting, a second opinion and, really trying to find someone competent. And if it seems like people agree, then okay, take the meds. But, it does have a tendency to, I think, be a little bit overdiagnosed depending on the trendiness of the times. And it's one where the medication, can kind of sedate you a little bit. And so you would just rather avoid that if it's an incorrect diagnosis. But if it's a real diagnosis and you've experienced mania, then the medication is going to be like a game changer for your whole life. Um, so that's, other than that, if you've been diagnosed with something else, I wouldn't be so, don't worry about the specific name or label, and just, if you feel like it's wrong, I would say that, and feel free to speak up to your provider. But the important thing is to not, I think, get alienated from seeking mental health treatment.
Okay. Thank you very much, Dr. Winarick, for your time and for sharing your expertise. Everyone's welcome to contact Dr. Winarick through his website. And again, I just really appreciate you taking the time. It's very interesting hearing about all these
Sure.
personality disorders and about your experience.
Yeah, no problem. My pleasure.